When working in a dental office, you must have certain skills and people skills and be able to talk to someone and be able to listen and have the correct voice quality. This is called verbal communication. And verbal communication is very important because how you answer someone, or like the tone of voice you use, the body language that you use, really makes an impression on the patient. You must use like certain words. You can't use certain words when describing something to the patient or in front of the patient if you're talking to the dentist or another coworker, because it might make them frightened. Most people are already afraid whenever they come into the dental office anyways, because they dread the having work done on their mouth anyways. So it's important that you don't use certain words, like, for instance, pain. Instead of saying, you might feel a little pain, you should probably try saying, you might feel a little discomfort, because whenever you say the word pain, there's just something about that word that makes people more afraid than what they already are coming into the office. And discomfort, whenever I hear the word discomfort, I'm like, okay, it might hurt just a tiny bit, or it might be uncomfortable, but it's not going to be just where I can't stand it. Whenever you hear the word pain, I always think, this is going to be very painful. Like, I'm going to hurt really bad, and I'm going to hurt afterwards. So you have to be careful of what your word use that you use. Whenever I go into the dental office to get dental work done, I don't really pay attention to what the dentist says. Like, I always ask the dental assistant, because I feel like I can ask her anything and she'd be honest with me. And I feel like the dentist is always rushed, so I feel like it's her responsibility and that I can ask her and she'd be honest with me whenever I ask her a question. So it is important that you make a good impression on the patient. The next thing is voice quality. Voice quality can be very difficult for me, especially, because even if you do get maybe a little irritated during the procedure, maybe it's because you felt like you done something wrong. It's nothing against the patient or the doctor, but maybe you feel like you messed something up, or you weren't quick enough for the doctor, or you just think that you didn't do something right. Well, that shouldn't change your tone of voice, because if you change your tone of voice or the way you say something, it might make the patient feel like you're upset at them. Or if you're mumbling and not talking loudly and clearly and just distinctly to the patient, they might think, well, she's not very respectful. She's not being respectful to me. She doesn't care about me and how I feel. So it's important, the voice quality that you use. And also, like, during an emergency, during the procedure, you and the doctor might see something that you did not expect. Just say you went to the doctor was extracting a tooth and you were assisting him. And then you got halfway through and you see that the tooth is really bad abscessed. Instead of, like, raising your eyes or, like, giving the doctor a look, you should just remain calm, because the patient is watching you and watching how you react. And if you remain calm and your voice remains calm, then the patient will more than likely remain calm during the procedure. There's 2 categories of questions. You must ask questions to obtain information from the patient. There is open-ended questions and closed-ended questions. Open-ended is questions that you expect to obtain large amounts of information, like, when scheduling an appointment, you can ask them, Miss Johnson, which day of the week do you prefer to come back for your 6 months cleaning? That's an open-ended question because they can't just answer with yes or no. They have to give you something specific, and they have to give you enough information for you to gather and get their answer, or schedule them a new appointment on that certain time, that certain day, later down the road. Closed-ended questions are questions that you can answer with yes or no. So you can say, Miss Johnson, have you been flossing twice a day? They would answer yes or no. And that might follow with the open-ended question, well, how many times do you floss? Do you floss every week? Do you floss once a month? And that would turn into an open-ended question. It's important to ask questions because you need to find out information about the patient, and once again, that builds a level of trust with the patient. If you ask them questions, they feel like you are concerned about them and that you are interested about learning about them, and there will be. Nonverbal communication, like I spoke about, is body language. The patient can tell whenever you are alarmed, whenever you are upset. So you have to really work on your facial expressions, your eye movements, your gestures. I personally have a problem with my facial expressions. I feel like most of the time if it doesn't come out of my mouth, then my face says it all. So I definitely need to work on that. But it's important that you not only, as a dental assistant, control your body gestures, your eye movement, your facial expressions, but you need to watch and be aware of the patient's nonverbal communication, because not always are they going to tell you when something's wrong. Not always are they going to talk to you. They may be shy. They still may be scared about even coming. So it's important that you watch whenever they don't want to communicate, whenever they just want to do the closed-ended questions, just yes or no, they don't really want to talk about anything. It's important that you watch their communication non-verbally. But there are high and low levels of behavior. Respect, empathy, warmth, the genuineness. So respect is an example. And respect, I feel like whenever the dental assistant looks at me directly eye to eye when I'm speaking, whenever they can, obviously not during a procedure, but whenever they speak to me in a clear tone voice, whenever they answer me and are not acting like they're trying to hide anything, they tell me as much as they can or as much as they know, I feel like that is respectful to me. Now, when I ask a question, when I go in the dental office and my dental assistant is turned out of the way, not even paying attention to me, mumbles, or just kind of gives me a short answer, I feel like that's disrespectful, because I'm coming in there, I am a patient, and I feel like I deserve the same respect as every other patient, and I feel like I should get the answers that I want or need to hear. So it's important that you are on a high level behavior. You shouldn't have to have the doctor or any other coworker tell you, you need to do better, because that would probably happen if you kept being disrespectful. Patients are gonna complain, and they're not gonna like that. So another quality as a dental assistant is listening skills. You should be a very good listener. I read in the book where 90% of all words spoken are not even heard, which makes me feel that's very discomforting, because I like for people to listen whenever I talk, whether it be about my dental procedure that I'm having done, or if I just need to talk to someone about some other problem that I'm having in my mouth that has nothing to do with that procedure. So whenever your patient comes in the dental office, you should be there to listen to them. You should listen first, then speak, and comprehend what the patient is saying. if you go in there in the procedure and sit chairside with the doctor and you're not listening to anything the patient had to say beforehand, then how are you, if you didn't listen to anything the patient said or complained about, then how are you going to tell the doctor? He would never know, or she would never know. So it's important, you know, you don't need to, whenever the patient's telling you something, you need to listen. Stop what you're doing if you have to, if you cannot multitask. You need to listen. You need to make eye contact. You need to not wander off in space, because a lot of times my mind is just wandering off in space. I do have a problem with that. I need to work on, but you should not let your mind wander. You should always look at the patient, make eye contact. Never stereotype the patient or anything they're telling you. You should never stereotype. You should go in there with an open mind and listen to the patient. If you follow those certain steps, you will be a good communicator. You will be a good listener. You will have the right voice quality. You will know the right words to use. But it's very important to be a good verbal communicator when working as a dental assistant.